Hello, I'm John Joseph, and I'm going to discuss a subject of hardcore addiction with you. When you or a loved one has a hardcore addiction to alcohol or drugs, there's several principles that you need to understand. The first thing that you need to know is any severe hardcore addiction, if somebody's a street addict, if they're out there using daily, hourly, if they are physically addicted, um, there is always two or three psychological disorders behind it. Um, Getting help if you have a severe addiction, or if it's a loved one of yours that has a severe addiction, is going to take a lot of time. It's going to take a lot of patience. First of all, the addict has got to want to reach out and get well. That's very important. Um, when they do decide to take that step, I'll summarize it for you like this. It's not going to be 30 days in a rehab and then they're going to come out and get back into society. It isn't going to happen, and they're not going to get well that fast. It's going to take at least about a 5-year period of time. They're going to have to go into a facility where it's locked down, where they can't leave, and there has to be group therapy in there. They have to have other addicts that are recovering, that they're assimilating with. They're going to have to get psychological treatment. They're going to have to find out exactly what psychological disorders that they have. They'll need to get on medication for those disorders, and it's going to be very time consuming. The first 6 months is just going to be drying out and trying to figure out what psychological disorders the addict has. Now, it's going to take time. When the hardcore street addict, the severe addict first stops, goes into the facility, they're going to need to be on medications that's going to calm them, because their body's going to be going through withdrawal. They've got physical withdrawal, they've got mental withdrawal, and once they're purged, once the body is purged from all drugs and alcohol, only then can a psychiatrist and a physician understand what mental anguishes, disorders the recovering addict is going through. Then they need to go through the process of getting on the right medications, and that could take a year or 2 years to find the right medications for any disorders that they have, for the disorders that they do have. On average, a street addict, a severe addict, when you see out there hooked on heroin, hooked on crack cocaine, they're drinking all the time, smoking pot, it's just constant, hourly, they're deluging, they're putting chemicals in their body. That addict is going to take time to get well. Once they go into rehab, the first 6 months is, like I say, just getting clean. It'll take up to another 2 years to find the right medications for them. It's going to be trial and error. And they're going to have to be in a situation to where after a couple of years, even after a year, year and a half, they go out of the rehab center and then they go into a halfway house, which is also a lockdown situation. It takes about 5 years for an addict to get clean. It takes a lot of diligence, and it's not going to happen overnight, and they're not going to get back into society right away. When they get back into society after 5 years, they're going to have to eliminate all their old friends are gone. There's no way they can get back in with them, hang around them. They've got to go to a different area. You know what happens a lot, and I see this in the poorer communities. You get somebody that they get clean, they go in for 6 months, say they go in for a year, which if it's a severe addiction, that is not long enough. But then when they come back out, they got nowhere to go. They don't have any housing set up, nothing. They go back, maybe to stay with the mother. Maybe that's where they were staying before when they got along with the mother. And it turns out to be the same neighborhood they used. So now they're going down the same streets, they're seeing the same people. There's the triggers coming back, and the mind reacts to that. The state has a lot of programs to get housing for people that have psychological issues and addiction. And they usually help you with the housing and with welfare, with food stamps, and of course, Social Security. You usually get those only after you've quit the addiction. So it's a very time consuming process. It's not going to happen overnight. But one thing you got to understand too, the hardcore severe addict, I've heard people say a lot, oh, that Timmy, he's no good. He's got them drugs. He's into those drugs. Those drugs ruined him. Uh, the problem is, it wasn't the drugs that ruined him. It was the underlying conditions. The psychological disorders were just too severe. His mind's just too unquiet. That when he first started just partying and wanting to get high here and there, he was self-medicating and it was making him feel better, and he didn't realize it. It was more than just the high of it. It was the calming down of the mind, or maybe the opposite if he was going through depressions. The cocaine brought him up and he felt more exuberant, and it's a long process. I just tried to touch on it here, but the hardcore severe addict, it's going to take 5 years for them to get well, and they've got to stay with the treatment and they got to stay in the system. I'll be talking more about this, and I'll get in more detail through the book Treating Addiction.info. And thank you.